Well, last night, we brought you the stories of 5 Oregonians who have had much-needed surgeries canceled because hospitals are too full of COVID patients. Some need heart surgeries, knee replacements, or hernia operations, and they're suffering while waiting for them to get rescheduled. Some of you wrote in to tell us you're going through the same thing, like Heidi, who said, "I'm in Hillsborough. As with many who contacted you, my OHSU surgery was canceled. I've known since March I needed surgery. I was just 4 days away from my surgery date and on soft food since March. I've been in the ER twice in August from the pain and worry every day if what I eat will make me go again. I am fortunate that my surgery has been rescheduled for September 17th, but I'm terrified it will get canceled. I'm so angry at the unvaccinated who are taking up space and making our hospital staff work so hard. Thank you for the story. I don't feel so alone." Well, you're certainly not alone, Heidi. We see you. And we know a lot of you are getting those calls that postpone your surgeries, and we know that's awful for you as well. But you're about to see it's no fun for the people who have to make those calls either. With hundreds, probably thousands of so-called elective surgeries being canceled across Oregon and Southwest Washington, there are lots and lots of phone calls being made and lots of heartache. But before we get too far in, let's talk about elective surgeries for a moment, a term that's misleading for many of us. This is Dr. Megan Frost, a surgeon at the Asante Hospital in Grants Pass.
We consider an elective case something that we see in the office and is scheduled. But that's not just including, a hip replacement or a hernia repair. That's including patients that have cancer. It's including patients that are at risk of stroke, at risk of heart attack, at risk of losing a limb. It is patients with conditions that I feel like are considered urgent. But right now, we again don't have the space or staff to take care of them in the operating room, and we definitely don't have the space or staff to take care of those patients after their operations in the hospital.
So that's why those surgeries are being canceled all over the state. There's no room because the hospitals are full, mostly with unvaccinated COVID patients.
See the doctor then.
Kristen Eckert worked 25 years in the medical industry, mostly in the Hillsborough area.
We had a lot of people that needed surgery, and so then I was the only one, and I'd call them and get them all scheduled and so forth, get them on the books, get all their pre-ops, post-ops, everything else.
She's one of those people who had to make the cancellation phone calls.
So then my job was then to call these people that I'd already made a rapport with and tell them, "Gosh, I'm really sorry, but we can't do your surgery."
Preparing for surgery is not a small thing. Getting it canceled a week or two before is awful.
It was a really crappy position to be in, to have to call these people that you're like, "Hey, guess what, Susie Q? We have to postpone your surgery." And they're like, "But I have people coming in. I have appointments made. I have childcare. I have transportation." And you're like, "I am really sorry." And there was no amount of apology that would fix it.
On busy days, she'd called 10 people or more, and it went on day after day. That would take a toll on anyone with a heart.
Horrible. Sorry. These people were looking so forward to being fixed, to feeling better, to getting normal back in their life, and to take that away it sucked. It was heart-wrenching, and you felt like a bad guy, and you had no control. Sorry. It was literally probably one of the worst feelings ever.
As if that was not bad enough, patients, understandably worried about their condition, would call back a week later.
What need to know? What was the plan? And sometimes we didn't have a plan quite yet. We just didn't know.
Yeah. And you don't have to apologize for getting emotional. It means that you care deeply.
Some people said too much.
Kristen said she worried about each patient, even when she was home. Eventually, it became too much. She left the healthcare field in late July. And in case you think her concerns are overblown, think again. Dr. Frost in Grants Pass is also worried. She's had to make calls to cancel her own patients. And while she's not aware of anyone who's died because they could not get an elective surgery, she does worry it's just a matter of time.
The problem is that, cancer at some point starts to spread, and those patients aren't going to die in the next few weeks. It's that's going to shorten somebody's lifespan by potential a couple decades because they die in the next 5 years. When if we could have operated on them today, you could have prevented that from happening and they would have lived 20 more years.
All right, let's count some vaccines. More than 2.71 million Oregonians have gotten at least their first dose now. That's more than 64% of the state's entire population. And yes, we're counting everyone, even kids under 12 who cannot get the vaccine yet. In Washington, more than 5.2 million people have gotten at least their first dose, which works out to about 68% of the state's entire population. That also includes kids.